Welcome to This Explainer. Today, we're diving into a historically terrifying autoimmune condition called pemphigus.
Imagine the microscopic glue holding your skin together, literally just vanishing. That is the reality of pemphigus.
It's a chronic disease where your own rogue antibodies attack the epidermis, forcing your cells to detach. The biological culprits? IgG antibodies. They mistakenly target crucial proteins called desmogleins. Think of desmogleins as your cellular glue. Depending on which one gets attacked, the disease looks totally different.
Deep pemphigus attacks desmoglein 3 in the lower layers, while superficial forms attack desmoglein 1 higher up.
In pemphigus vulgaris, the most common deep form, the nightmare almost always starts invisibly, right inside the mouth. Patients suffer agonizing, unhealing mouth erosions for months before a single skin blister ever shows up. Eventually, the attack breaches the skin, spawning these large, loose blisters across perfectly normal-looking areas. A huge clinical clue is a positive Nikolsky sign, where healthy-looking skin easily shears away with slight pressure. A rarer deep variant, Pemphigus vegetans, skips simple blisters, forming foul-smelling, vegetating plaques instead. Conversely, superficial types, like Pemphigus foliaceus, mainly cause scaly crusts and mercifully spare the mucous membranes entirely. So how do we confirm this chaotic attack? Dermatologists deploy a rigorous 5-step diagnostic toolkit. First up, a Tanzik smear reveals epidermal cells that lost their connections and abnormally rounded up. Next, direct immunofluorescence makes the invisible visible, causing the attacking IgG antibody network to literally glow. Visualizing this is absolutely crucial to distinguish pemphigus from look-alike conditions, like during disease.
Unlike pemphigus, during disease hits younger patients with tense, intensely itchy blisters and a negative Nikolsky sign.
Getting this diagnosis right is vital. Why? Because left untreated pemphigus is universally fatal within 2 years.
Fighting back requires a harsh arsenal: topical care, high-dose systemic corticosteroids, and heavy immunosuppressant drugs.
But here's the tragic irony. Today, patient mortality often stems from complications of prolonged steroid use itself. It leaves us with a profound question. Once the body attacks itself, can we ever truly make it forget?